I speak on behalf of my fellow regional directors in all regions. I would like to bring to your attention a pressing public health issue that impacts us all, regardless of age, region, or background. Social isolation and loneliness are pervasive problems that demand our collective action. We have a crisis. 1 in 4 older adults and at least 1 in 6 adolescents experience social isolation or loneliness. While these can affect anyone, they are much more likely to impact individuals with physical and mental health problems and disabilities. The risk of experiencing social isolation and loneliness is increased by excessive technology use among young people and aspects of the urban environment such as poor public transport and lack of communal spaces. A lack of social connection increases mortality rates by 14 to 32%, raises the risk of stroke by 32%, and cardiovascular disease by 29%. It is also linked to higher rates of anxiety, depression, and suicide. And 5% of global dementia risk is attributable to social isolation. Significant life changes, such as retirement, loss of loved ones, migration, disability, or reduced mobility put older adults at heightened risk. Beyond health, social disconnection has far-reaching impacts on education, employment, and the economy. It imposes costs to society by reducing productivity and job satisfaction and diminishing educational attendance rates. Until recently, social isolation and loneliness were largely overlooked as critical social determinants of health. However, following the COVID-19 pandemic, the importance of addressing social isolation and loneliness is evident. Research in recent years has yielded promising strategies. The solutions span national policies, social infrastructure enhancements, and targeted interventions like social prescribing, cognitive behavioral therapy, and psychoeducation. Some countries have begun to recognize these issues as pressing public health concerns and have started instituting policies and interventions to tackle this issue. While WHO has initiated efforts to catalog this evidence, further synthesis is needed to distill clear, actionable recommendations for policymakers and practitioners in order to foster meaningful social connections. In some regions, efforts have been made to actively support countries in developing national strategies and advancing age-friendliness, ensuring that social connection remains a key priority towards healthy aging and inclusion. Honourable Chair and Excellencies, in light of these findings, it is imperative that we prioritise social connection as a public health issue. We must take collective action to address the root causes of social isolation and loneliness and work towards creating a more connected and compassionate society. I thank you.